Hey everybody, in this video we're going to talk about one of the most controversial topics out there, gluten. Celiac disease is a serious problem that millions of people have to deal with on a daily basis. In this video we're going to break down the truth about gluten and how it affects celiacs. A lot of people are talking about it these days, but what exactly is it? And more importantly, what does it do to people who have celiac disease? I'm going to answer all these questions and more, so stay tuned. Don't forget to subscribe to Naturally Healthy Today, and now let's get into gluten. What is gluten? Gluten is a protein found in wheat, rye, and barley. It's also found in many processed foods. When people with celiac disease eat gluten, it damages the villi in their small intestine. Villi are tiny finger-like projections that line the small intestine. They help the body absorb nutrients from food. If the villi are damaged, the body cannot absorb nutrients properly. This can lead to malnutrition and other health problems. Celiac disease is a serious autoimmune disorder that can be damaging to the small intestine if left untreated. People with celiac disease must avoid all forms of gluten in order to prevent serious health problems. When people with celiac disease eat gluten, it causes an immune reaction in their small intestine. This reaction damages the villi and can lead to malabsorption of nutrients. Malabsorption of nutrients can cause a wide range of health problems, including malnutrition, anemia, and osteoporosis. Celiac disease is a serious autoimmune disorder that can be damaging to the small intestine when left untreated. People with celiac disease must avoid all forms of gluten in order to avoid all these problems. What about wheat? Some people with gluten intolerance are also allergic to wheat. Wheat allergy is different from celiac disease, which is an autoimmune disorder that can damage the small intestine. People with celiac disease must avoid forms of gluten, but people with a wheat allergy are allergic to the protein in wheat. When they eat wheat, their body has an allergic reaction. This reaction can cause a lot of symptoms, including hives, wheezing, and difficulty breathing. In severe cases, it can lead to anaphylaxis, which is a life-threatening condition. Let's talk about gluten-free diets. Gluten-free diets have become popular in recent years, even among people who do not have any medical condition that requires them to avoid gluten. Some people believe that eliminating gluten from their diet will help them lose weight, have more energy, or even feel better overall. There is no scientific evidence to support these claims, however. There's a wide variety of gluten-free products available on the market today. Gluten-free bread, pasta, and snacks can be found in most supermarkets. There's also many gluten-free products available online. If you are celiac or have a gluten intolerance, it's important to read labels carefully. Some products that are labeled gluten-free may still contain trace amounts of gluten. Always check with your doctor before trying any new food or supplement. If you think you may be intolerant to gluten, talk to your doctor. They can order a blood test to check for celiac disease. If you don't have celiac disease, you may still benefit from avoiding gluten. Many people find that their symptoms improve when they cut gluten out of their diet. Who can diagnose gluten allergies and how do they do it? A doctor can diagnose a gluten allergy by ordering a blood test. The blood test will check for antibodies that are present when someone has an allergic reaction to gluten. If the blood test is positive, the doctor may order an intestinal biopsy to confirm the diagnosis. An intestinal biopsy involves taking a small sample of tissue from the small intestine and looking at it under a microscope. Some people with a gluten allergy may also have a wheat allergy. A doctor can diagnose a wheat allergy by ordering a blood test or a skin prick test. A skin prick test involves placing a drop of liquid containing wheat protein on the skin and then pricking the skin with a needle. If the person is allergic to wheat, they will develop a red, itchy bump at the site of the prick within 15 minutes. If you think you may have a gluten or wheat allergy, talk to your doctor. They can order the appropriate tests to make a diagnosis. Let's talk about food allergy versus food intolerance. What is the difference between a food allergy and intolerance? A food allergy is a reaction of the body's immune system to a particular food protein. When someone with a food allergy eats the offending food, they may experience symptoms such as hives, wheezing, or difficulty breathing. In severe cases, anaphylaxis can occur, which is a life-threatening condition. A food intolerance is a negative reaction to a food that does not involve the immune system. People with a food intolerance may experience digestive problems such as gas and bloating after eating the offending food. They may also experience headaches, fatigue, or skin rashes. A food intolerance is generally based on symptoms and ruling out the other possible causes. For example, if someone experiences digestive problems after eating dairy, a doctor may diagnose them with lactose intolerance. How are food allergies and intolerances treated? The only way to treat a food allergy is to avoid the offending food. This can be difficult as many foods contain multiple ingredients. Reading food labels carefully is important for people with food allergies. There is no cure for food intolerance, but symptoms can often be managed by avoiding the offending food or taking digestive enzymes. Some people with a mild intolerance may be able to eat small amounts of the offending food without experiencing symptoms. If you think you have a food allergy or intolerance, talk to your doctor. They can order the appropriate tests and help you make a diagnosis. Read food labels to avoid gluten. Most packaged foods in the United States are required to list their ingredients on the label. This includes all food allergies, which must be listed by either the name of the ingredient or the word contains. For example, if a food contains wheat, it must say so on the label. When reading food labels, always look for these key words: wheat, flour, bread, macaroni, rye, barley, oats, malt, brewer's yeast, starch, modified food starch, dextrin, hydrolyzed plant protein, hydrolyzed vegetable protein, textured vegetable protein. If any of these ingredients are listed on the label, the food contains gluten. Always check with the manufacturer if you are unsure about whether a food contains gluten. Many foods that contain gluten will have a contains wheat or may contain wheat statement on the label. Some foods that do not contain wheat may still contain gluten. For example, oats are naturally gluten-free, but can be contaminated with gluten during processing. If you are celiac or have a severe gluten intolerance, it is important to only eat oats that are labeled gluten-free. If you have celiac disease or a gluten intolerance, you will need to avoid all foods that contain gluten. This can be difficult as gluten is found in many common foods. Reading food labels carefully is the best way to ensure that you're avoiding all foods that contain gluten. So how do you maintain a healthy diet? Make sure to talk to your doctor. Let's talk more about digestive enzymes and how they can help food intolerance. Digestive enzymes are proteins that help the body break down food. They are found in the saliva and in the digestive juices of the stomach and small intestine. There are many different types of digestive enzymes, each of which breaks down a specific type of food. For example, amylase breaks down carbohydrates, lipase breaks down fats, and protease breaks down proteins. Digestive enzymes are important for good digestion. Without them, the body would not be able to absorb nutrients from food. Some people with digestive problems may benefit from taking digestive enzyme supplements. These supplements can help the body break down food more effectively. However, it is always best to talk to your doctor before starting any new supplement. If you think you may benefit from taking digestive enzymes, talk to your doctor before starting any new supplement. If you have celiac disease or a gluten intolerance, you're not alone. There are many resources available to help you live a healthy and happy life. Let's talk about resources for celiac and gluten intolerance. There's a lot of resources available to help celiac and gluten intolerance patients live a healthy and happy life. Here are some of the most helpful. Celiac Disease Foundation. The Celiac Disease Foundation is a national nonprofit organization that provides support and information to people with celiac disease and their families. They offer a wide range of resources, including a gluten-free restaurant guide, educational materials, and a directory of doctors and dietitians who specialize in celiac disease. Gluten Intolerance Group. The Gluten Intolerance Group is a national nonprofit organization that provides support and information to people with gluten intolerances. They offer a wide range of resources, including educational materials, an online forum, and a directory of doctors and dietitians who specialize in gluten intolerances. National Celiac Association. The National Celiac Association is a national nonprofit organization that provides support and information to people with celiac disease and their families. They offer a wide range of resources, including educational materials, an online forum, and a directory of doctors and dietitians who specialize in celiac disease. Celiac Sprue Association. The Celiac Sprue Association is a national nonprofit organization that provides support and information to people with celiac disease and their families. They also offer educational materials, an online forum, and a directory of doctors and dietitians who specialize in celiac disease. GIG. GIG is another national nonprofit organization that supports gluten intolerance patients. They offer a wide range of resources, educational materials, online forums, and a directory of doctors and dietitians that specialize in their gluten intolerance. Dietitians can help you manage your gluten-free lifestyle. If you have celiac disease or gluten intolerance, you may want to consider seeing a doctor or dietitian who specializes in these conditions. A doctor can help you manage your condition and make sure you are getting the nutrients you need. A dietitian can help you plan a healthy diet that is low in gluten. There's so many resources available to help celiac and gluten intolerance patients live a healthy and happy life. It's easy to find a directory of doctors and dietitians who specialize in celiac disease. These professionals can help you develop a tailored plan to meet your nutritional needs. Please consider subscribing for more Naturally Healthy Today and check out this video on lactose intolerance right here.